really bad. Muscle energy technique for a sagittal plane iliosacral issue. Sagittal plane meaning anterior or posteriorly rotated. Okay? The reason why the muscle energy technique is a bad name is because, what does that mean? Muscle energy, it sounds a little esoteric. Muscle energy, simply what we're saying here is we're going to do isometric mobilizations. That's a better term. Isometric mobilization. So essentially what I'm going to do is I'm going to cause a muscle to contract and I'm going to stabilize its distal insertion. And by doing so, that muscle as it contracts is going to move its proximal insertion. Right? So I stabilize the extremity in such a way that I elicit a contraction of a muscle, but I'm blocking it distally, so wherever it attaches proximally, it's going to move. So if I wanted to move the ilium anteriorly, what muscle would I use? Iliopsoas rectus femoris, right? I would use that muscle. Big, strong muscle. Can you see how that would kind of pull the innominate into anterior rotation, right? And what muscle will I use to pull it into posterior rotation? Hamstrings, right? So they're the muscles that I'm going to use. Isometric contraction to mobilize the joint. Why? To reduce pain in an SI, to increase motion, to correct a positional fault. How do I know I made a difference? I go back to the reproducible sign or symptom. Okay? So this one is nice because what I'm going to show you is how to fix her posterior rotation on the left side at the same time that I'm fixing an anterior rotation on the right side. We're actually doing force, counterforce. So if we do our supine to lung sit, we're not sure if one is back and one is forward. Remember that confusing discussion? This technique actually works on both at the same time. I think there's value in realizing which one is the problem, but this one kind of hits both. And I'll show you how we do it. So you're going to slide a little closer toward me. Knees are flexed. So what I'm going to do is I'm going to try with this left side to pretend for a moment that I want to move this side anteriorly. So to do that, I'm going to use the rectus. So I'm going to give her force here. And I'm going to ask her to push up. Can you see how if I block her here and she pushes up, it's going to pull, that rectus is going to pull on the left side? Force, I'm addressing this side, but my counter force is going to be over here. I'm doing force, counter force. Why? Big patient, sometimes I can't because it's hard for me to do both of these, and a lot of people prefer not to. The reason why I do is because it allows me to not have to have them elicit as much force. If I give her counter force over here, it stabilizes this side, and now I don't need as much force to get this side moving. So I'm going to recommend this, but you don't have to do it this way. I'll show you variations of it. You're going to see this done about 25 different ways. Lots of ways of doing this. Okay? I'm going to show you the hardest way. It's the way I prefer. So I'm going to use the rectus here. So I'm going to essentially have her isometrically go into hip flexion here. I'll position her here. And on this side, I'm going to have her push that way. So I'll say push this leg out, pull this leg up. And she does it at the same time. So go ahead and push. So the left side is flexing, the right side is extending. I'm using the rectus on the left, the hamstrings on the right. So on the right side, what am I doing to that pelvis? On the right side? Posterior. Posterior. And on the left side? Anterior. You see that? I could just do this. Go ahead and pull up. If I'm really just addressing this side, I could do that, but then nothing's stabilizing this side. So what do? Well, I can have her push down. So on your own, just push down. Or I can have her use her adductors. Slide over to your right a little bit for me. So I'll have her hook here and push her leg in that way. Why? Because I'm trying to get those muscles to lock that side of the pelvis. And go ahead and pull up. So she's locking in this side as I'm doing this side. Lots of different ways of doing it. I could come over here and have her come down for me. Bend your knee. Right? And I could have her okay, go ahead and push into me and pull up. I can have her do that way. Right? Lots of different ways of doing that. Force, counter force, and it's a muscle energy, right, or isometric mobilization technique to try to restore sagittal plane positions. Remember the criteria in our exam that's going to determine whether or not we want to do this, and how many of these we got for each one.